Okay, so here is what we would like to share with you all today. We are going to start with some general project updates. For those of you who are newer partners of ours, we're going to share the goals of our project. For those of you who are long-term partners of ours, it'll be a refresher. So we have some other things that we're going to share from our end in terms of some exciting research that is about to be published, as well as a new method of handling programming requests. So we've got a fair amount to share from us. Then we will have Maryland Coalition of Families share about their programs and highlight them as one of our partners. And then we will share some. We will offer you all the chance to provide us with some feedback directly about our programming and what we're up to. So, all right, let's move right into our project updates. So I'm going to have various members of my team sharing the different parts of our updates today. And I'm actually going to turn it over to Cheyenne, who is our data manager, to share briefly just a numerical overview of our accomplishments during the history of the ROPTA program.
Hello, everyone. Nice to see some new faces here. So just a quick rundown. Our program is continuously growing, and the people who are participating in our events seem to be super satisfied, since we have 98% of people who participate in the training recommend the training either to another coworker or somebody in their community. Overall, we've had over 5,500 people attend a training. Over 1,700 people of those 5,500 were with our mental health first aid. Overall, over 60 new mental health first aid instructors were certified. And our total partner numbers is 175, which is great. It's always nice to connect and to have the opportunity to spread out through Maryland, because a lot of us are pretty centralized. And here are some of our feedback from people who participated in our events that were pulled from some of our surveys. And that's all there is for me.
Thanks, Cheyenne. All right, now we're going to turn it over to Julie, who will do an overview of our program offerings.
Sure, yeah. So I did see in the chat that we did have a question about what exactly it means to be a partner. I didn't know if you wanted to address that first.
Okay, sure. So partners we view in a very broad sense. For us, partners are those folks who have co-sponsored trainings with us, and or helped us promote our programs, or simply hosted one of our trainings. We are a lot of our trainings are done directly for specific offices or agencies, and so we consider you a partner in welcoming us into your office. So very broad definition.
Yeah, thanks Alex.
Yeah.
Yeah, so this last year we had a lot of great partners through, Maryland Coalition of Families, Anne Arundel County Health Department, a variety of programs. And then, so anyone who also, shares our programs, that's really appreciated as well. So I wanted to provide an overview of our ROPTA programs and trainings. And so we're going to go into mental health first aid in the next few slides here, and then we'll circle back around and talk about the other three categories. But our programs kind of fall into four main buckets. So the first one is mental health first aid. You know it, you love it. It's been a really huge showcase and strength of ours. So mental health first aid, we do offer adult mental health first aid, youth mental health first aid. We once or twice a year, we offer mental health first aid certification training. And then we have new versions of, we got trained in new modules offered by the National Council for Mental Wellbeing. So we also are now offering mental health first aid for rural populations and older populations. So that's really great. We are able to do those both in person and virtual. Then, of course, we have Overdose Lifeline, and that is an evidence-informed training series aimed at raising overdose awareness, teaching prevention strategies, and educating about local and national resources. Underneath the Overdose Lifeline series, we offer training such as removing the shame and stigma of addiction, the brain and the disease of addiction, guide to harm reduction, and the opioid public health crisis. And you can kind of do those a la carte, or you can do them all in a series. Sometimes we actually just kind of pull from all of our buckets. It's really great to be able to do that and really customize and tailor our program offerings to the need of the community and our partnering organizations. Next, we have Regrounding Our Response, and that is a series developed by Maryland Department of Health, and it works to promote awareness, resources through evidence-based strategies for reducing overdoses and substance misuse. And so under that category, we have training such as adverse childhood experiences, or ACEs, medications for the treatment of substance use disorder, formerly known as MAT, social determinants of health, stages of change, and comprehensive care framework for people who use drugs. And then we have the Generation RX, and under that one, we have that is an evidence-based, evidence-informed prevention, education, and awareness program designed to educate people of all ages about safe medication practices, storage, and disposal. We can do that all the way from as young as elementary school, all the way up to, older adults. And we've gone into community centers, senior centers to do that. And so we'll go into those a little bit deeper in upcoming slides. Next. All right, but first we're gonna dive a little bit deeper into the differences between those 4 versions of mental health first aid. Of course, adult mental health first aid teaches you participants how to identify, understand, and respond to signs of mental health and substance use challenges among adults, and that is defined as 18 and up. So it goes through common signs and symptoms of mental health and substance use challenges, how to interact and approach and assess a person in crisis, how to connect that person to help, and really helps individuals become more familiar and resource literate in the services in their communities. And it does have expanded content on trauma, substance use, and self-care. The next one, youth mental health first aid, that teaches adult participants how to identify, understand, and respond to signs of mental health and substance use challenges among youth. And that also has the common signs and symptoms of mental health challenges and substance use challenges, how to interact with a child or adolescent in crisis, how to connect that youth with help. And then, of course, it does have an emphasis on trauma, substance use, self-care, and the impact of social media and bullying. For these both adult and youth mental health first aid, there is a 2-hour self-paced online course, and for the virtual, and then it's a 6-hour virtual instructor-led training. But we can also offer it in person, and during that course, there is not a preliminary 2-hour online course, pre-work course. It's all kind of done on-site in person in a 6.5-hour instructor-led training. And I know we're going to go over this, but if you are interested in getting signed up for that, for requesting one, that is our new request form for mental health first aid. And then moving on to the next slide, we're going to go over the new mental health first aid modules. So like I said, we have mental health first aid for rural communities, and that helps adults acknowledge and begin to address the significant challenges in accessing mental health care in rural communities. So really helping them understand, both the benefits and some of the challenges of living in rural communities, those risk factors, their protective factors, and really learning how to apply the ALGE action model in scenarios that reflect rural communities and their unique needs and experiences. And then, of course, it goes into the kind of resources that are available in those unique living communities. And it really does, it kind of uses that strength-based approach, really acknowledging that rural communities have the benefits of strong, supportive neighborhoods and friends and families, and really how to use that when those strength-based approaches and when motivational interviewing and working with a family or working with someone who comes from a rural community. And then the second new module that ROPTA offers is mental health first aid for older adults. And that teaches individuals and participants how to improve the quality of life for older adults, aging adults, by assisting and supporting those who are experiencing mental health or substance use challenges, later on in life. So it really goes into the unique impacts of substance use, mental health issues when it comes to working with older adults, older communities, really explores the risk factors as well as protective factors that are specific to older adult communities. It does have new scenarios to really help participants practice the action plan to really reflect those needs of and experiences of older adults, and goes into those relevant resources. Just so you know, the new modules, these 2 new modules, are a little bit longer because they kind of extrapolate a little bit more. They go a little bit more deeper into some of these scenarios and skills learning practices. So the in-person training is 8 hours. And the virtual version of the training is, again, the 2 hours of pre-work plus the 7-hour virtual live instruction training. All right. And you can use that link I just shared with you to request any of these mental health first aid trainings.
All right, great. Just for a clarification, I had pasted the one that's on the slide. Should they use the one that you put in the chat or the one that's on the slide?
That is the same one. Oh, sorry. What do you?
Yeah,
the one that's on the slide is the one that I put in the chat.
Yours says MHFA-ROPTA, and then the one that's on the slide says MHFA with ROPTA.
Interesting. Let me confirm that, and I will. I think they're both the same, so that's cool.
Okay, they both go to the same place. Great.
They do.
All right. So I wanted to also highlight some of our emphasis on a few counties in Maryland. So there is a funding stream that we have from the USDA NIFA that although our programs are delivered throughout the state, we do have some specific funding dedicated to these 5 counties that you see highlighted on your screen. They meet certain codes. I know that some of you all who work in rural spaces know that the definition of rural varies from agency to agency and even office to office within the same agency. And so the USDA Economic Reporting Service has a set of continuum codes which take into account proximity to urban centers, regardless of even if it's a small urban center. So for example, why isn't Somerset, which is quite rural, counted here? Well, because it's close enough to Salisbury that it doesn't count. So anyway, our programs are offered throughout the state. However, we are trying to emphasize a subset of our programs in these areas. So state, again, is a we offer throughout the state. But actually the rest of our programming, we're really looking for more participation from these 5 counties. So the programs that we'll share a little bit more about in just a second, but the Regrounding Our Response and Overdose Lifeline programming, Generation RX, this is not about drugs for youth, as well as some of our pain management, which is new, and health insurance literacy programming. These counties that we have highlighted, we want to especially recruit participants for our programming from those counties. So if any of you on this call right now live, work, know people in those 5 counties and they're not here visiting with us right now, we encourage you to share our information with any of your contacts in those 5 counties because we're really looking to serve, have a special emphasis on those counties. Again, emphasizing that we are open to all throughout the state, but that we're trying to make a special effort given the funding from USDA for these counties. All right, so a little bit more about these programs. I'll turn it back to Julie.
Great. Okay. So yeah, I wanted to dive a little bit deeper into some of these programs. So again, the Regrounding Our Response program, that is a series that was developed by MDH, Maryland Department of Health. So just to kind of give an overview of each one of these stages of change gives a explanation of the trans theoretical model of change that was developed back in like the 70s. And it really helps people understand how intentional behavioral change happens and how to support people through the process of change in relation to which stage the person is in. So, they'll go through the contemplation, pre-contemplation, and all of those stages. The next one is social determinants of health, which you might hear as the acronym SDOH. That helps identify the determining factors that can affect individual and community wellness. And it can explore what can be done to improve health outcomes, health equity, support, and anti-stigma at all levels. You may have heard that a person's zip code sometimes has more of an effect on their health than their genetic code, and that's what SDOH goes into. Next, we have adverse childhood experiences, or ACEs. That is that longitudinal study that happened back in the 90s between the CDC and Kaiser Permanente. And so what it goes into is exploring how toxic stress alters the physiology of early brain development in children up until the age of 18, contributing to the relationship between trauma and substance use and mental health. As well as it goes a lot more into the role of protective factors, risk factors, and community resilience as a whole. The next is the Comprehensive Care Framework for People Who Use Drugs, or PWUD, and that seeks to teach the effects of stigma on health while also looking at harm reduction strategies, infectious disease prevention, and how to implement a health framework for people who use drugs. And then the final one, rounding out the ROR series, or Grounding Our Response series, is medications for the treatment of substance use disorder. And this is where we will examine the data behind medication treatment for those with opioid and other substance use disorders, and how this treatment can actually decrease stigma and the number of overdose deaths and infectious diseases. These trainings are typically at minimum 1.5 hours, but we have been able to do them up to 3 hours if needed. And again, you can use this link here that I will drop in the chat in just a minute. All right, and then the next is we have Overdose Lifeline. And Overdose Lifeline is an organization out of Indiana. And they also offer a variety of programming, and these are the ones that we offer in the series. So the first is the Brain and the Disease of Addiction. This is one of my favorite ones. This one explores how addiction develops, as well as kind of goes into the role of neuroplasticity and what that plays in addiction and recovery. The next is we have Removing the Shame and Stigma of Addiction, and that explores the effects that shame and stigma have on addiction, and kind of learning and exploring new solutions for combating it. The opioid public health crisis really goes into the 3 waves of the opioid epidemic, and it kind of goes into the risk factors, the causes, and explores a multifaceted solutions approach. Guide to Harm Reduction seeks to help people understand the advantages of harm reduction and how it can prevent further complications of drug use. And then this is not about drugs. This is our youth-based program, youth-focused program. It's additionally an evidence-based universal program by youth for youth to educate youth about opioids and other substances. It has about a 12-minute video. There's a discussion. There's a lot of follow-up questions. There's even a website that we can hand out to the students to really get them engaged. And we've had a lot of success teaching this to high schoolers out actually in Western Maryland. So it's a really great program, and I encourage you to learn more. And we'll drop the flyers for all of these in the chat in just a moment. And then so finally, the last one is Generation RX. And again, this is an evidence-informed prevention, education, and awareness program designed to educate people of all ages about safe medication practices and the potential dangers of misusing prescription medications. And so some of the learning objectives are understanding the history of prescription drug use epidemic, the overprescribing, the normalization, and the advertising of prescription drugs. But it also goes into the understanding and really emphasizing the importance of taking medications exactly as prescribed, as well as exploring some alternatives to pain management. And then, of course, it goes into how to securely store and dispose of prescription medications and how to employ these safe medication practices in your own home and your neighbor's home, your community's home, and how to teach others to do the same. And again, this is 1 hour long. All right.
All right, so now we're going to have Jade Hackley, who is our program coordinator, to share with you all some updates and how we are receiving the volume of requests. We want you all to be able to access our services, and it's a great thing that we're dealing with a lot more requests than we have in years past, and so we've developed a new procedure that we wanted to share with you all on how to make sure that we get your request and can get a course set up for you.
Hello, everyone. So I would like to first direct you to our website, Maryland ROPTA, and I'll put it in the chat. We created some Google Forms to be able to better assist you all to request courses. So first, if you're on our website, you can go down to our services section and that'll show you the information about all of our different programs. It has the flyers for each one, so you can go through and find out all of the information about each training that we offer and review all of the information. And then while you're there, at the bottom, there's a link to click, and I'll put it in the chat. But this is what the form looks like for our interest form for mental health. It just goes through and asks all of the questions that we need to find out information so that we can move forward with getting you scheduled. Just time frames, making sure you all know what is offered through the program. Thank you, Julie, for sharing that in the chat. So if you move down, we have one specifically for mental health first aid, simply because there are a lot of different programs under there. And then if you go to any of our other programs, there is a link to be able to schedule a presentation, and it will lead you to this page, which I will put the link in the chat. Thank you, Julie, for sharing our program packets. So our program packets, as you can see through the form, there's also links as well to direct you back to the website. Once you go to the next page, it'll show you, simply just ask some more questions if you're asking for an organization or for yourself. And then once you get to the different types of training, we have a link that directs you right back to the website, as well as overview of the program. And you can select all that you are interested in. Once that's been completed, I will reach out to you and your team to determine what dates you all are available for. The greater the range, the easier it is to find out match it up with the availability of our instructors. You can also send us an email as well to our Maryland ROPTA email address, which I am putting in the chat right now. Thank you, Julie. In case you have any other questions, please feel free to shoot an email and I will be able to reach out to you. If you need to set up a session so that a virtual meeting so that we can discuss a series of courses for your organization, that works perfectly. Because a lot of the times you find out you're interested in one subject and then realize that we have more to offer that are related. So for all of our programs, mental health first aid, there is a limit to the participants due to the type of course it is. For all of our other trainings, it's really open because they're more webinar based. So feel free to shoot us an email or use the interest form if you're interested in any of our programs. And if you have any additional questions, please shoot us an email and I'll be happy to respond.
Thank you, Jade. So it's been a real blessing to have a program coordinator, full-time part of our team. So we're really thankful to Jade for her assistance in getting us all in order. So now, before I turn it over to our partner spotlight, I did want to share with you all some results of a research study that we did. Very briefly, it's about to be published and we will share it all out with everybody on our newsletter once it is published, but it's in press, so I feel comfortable sharing the results. We interviewed you all, a year to a year and a half ago. We did some interviews with former mental health first aid participants and transcribed the interviews, analyzed them. We were really curious as to the emotional experiences of mental health first aid trainees. What is it like to actually implement the skills after the training? You have your evaluations of how the class itself went that are part of the standard protocol, but we wanted to know after all of that, when you're out there in the world, what is it like? And so the three big points that our participants in that study shared was that confidence and gratification are two of the most common experience, that mental health first aid allows people to approach others with more confidence and then to feel a sense of gratification that, wow, I was able to help somebody. And that's really significant in encouraging people to keep helping. There's also, we also found that delivering mental health first aid requires a lot of personal emotion regulation. So, you know, the situations that you might encounter may be scary or just, you know, somewhat upsetting. And so in order to help others, you know, there's a degree of personal control that goes into that. And we recognize that a lot of our trainees too, in this study said that they had, you know, the reasons for seeking out training in the first place was their own experience with mental health challenges of themselves or their family members or friends. So we've already started, I know that myself as an instructor, I've already started to incorporate this into the trainings that I offer. You know, I try to forecast for my trainees now, like, hey, you know, we're giving you all these skills now and you will feel confident, but it's also still going to be hard. So don't just because you feel those emotions doesn't mean that you're doing something wrong. So I've tried to incorporate that into how I train people. So we're excited to share the official publication. It'll be in our newsletter once it's out there, but it's coming soon in the Journal of Human Sciences and Extension. So thank you all for participating in that study, if anyone on here did, and your results have already started to affect how we do our trainings. All right, so now I'm going to turn it over to our partner spotlight, which is Maryland Coalition of Families. So I'm guessing, Karen, you would like to share your screen. So I'm going to give you that permission now. Go for it.
Great, thank you. And thank you all so much for having MCF come in and talk with you today. I'm always just impressed by the breadth and depth of the work that you all do here at ROPTA. So thank you for allowing me to sit in and see all of that. I also recognize that I have two colleagues on the call here today, Jamie and Sherry. So you guys, if I forget anything or misstate anything, I expect you to jump in and keep me straight. I'm just going to share my screen. Okay. All right, can everybody see that?
Yes.
Okay, great, thank you. Okay, so I'm going to really today try to give you a Reader's Digest version of all the things that Maryland Coalition of Families does, because we, like you all here at ROPTA, have a wide breadth and depth of the work that we do across Maryland. We have been an organization, a statewide organization, the first and the primary provider of family peer support services statewide. So we have 60 to 65 family peer support specialists across the entire state in all 24 Maryland jurisdictions. So we have staff who live and work and support the families in the communities where they spend most of their time. They are very well familiar with the resources available because they probably use them themselves to help to support their own families. And when we talk about families, what we really mean is you know, family is a definition that we don't want to be the one deciding what that is. So we're working with parents and caregivers and grandparents and aunts and uncles and siblings and adult children. Really the range of what we define as a family is wide open. If folks feel like they are a family, you know, despite whatever that definition may be, we're there to support them and help them through it. All of our services are offered free to all the families that we support, and that's not just our family peer support services, it's our education events, it's our support groups, it's any of the other programs that we'll talk about today. So everything that we do is free. And we are what's known as a family-run organization. So at least 51% of our board of directors are people with lived experience, as is our executive director, as is our chief program officer, all the way through to our family peer support specialists out in the field. Some of our other staff in our central office, our administration, also have lived experience. I am the mom of a young adult who has bipolar disorder and autism. So I bring that experience to this work. But most of the folks doing this work directly, or all of the folks doing the work directly with the families, have lived experience. We work in a wide range of different disciplines. We sort of spell it out and say mental health, substance use, and problem gambling. But as I'm sure you all are aware, these things are not in a box anywhere. We're seeing a lot more of that co-occurring, and we've spent a lot of time in the last couple of years really training our staff on understanding and recognizing the interplay between all different kinds of disorders. And so it's sort of a misleading, I guess, to say it in these boxes, but there you have it. These are the sorts of challenges, behavioral health challenges, that we're supporting families with. And at this time, through lots of great funding opportunities and lots of folks at BHA having faith in our work, we've gotten funding to support any family who has a loved one of any age with a mental health, substance use, or problem gambling disorder. So we're not confined any longer to, somebody's age or the type of disorder that they have. We're there to support the entire family through it all. Our main service, as you all may know, is family peer support. So again, all of us have lived experience caring for someone who has a behavioral health challenge. The crux of family peer support really is that emotional one-to-one support that we offer our families, because we've been there too. And we can help them find those resources. We can help them navigate those systems. But really, at the end of the day, it's the emotional support that we provide, because we know what families are going through. We know the fear and the grief and the shame and the blame and all the emotions that get wrapped up in sort of navigating the world that is having someone that you love who has serious behavioral health challenges. So that is probably that just weaves throughout all the work that we do. But again, we also do a lot of resource connections. We have families that come to us who come in maybe for some family peer support, and as we're working with them, we're finding out that they have other needs, right? They might have food or housing insecurity. They might have financial or legal challenges. And what we know is that it is very difficult for a family to tend to some of those higher order needs, like their mental health, like treatment and that sort of thing, if their basic needs are not being met. So we try to take a holistic approach to that and make sure that the families have their needs taken care of in other areas, so that they can really devote the time and energy to taking care of themselves and their loved one. Systems navigation is a huge thing that we do. We've all been there, right? Trying to navigate these complicated systems, whether it's the school system or your healthcare providers, or all of those things together. And then you throw in child welfare, and you throw in juvenile justice, perhaps, the justice system. It gets really, really dicey, right? So we have staff who have that kind of experience and can support families through that. We also offer support groups statewide. One of the nice things, well, I don't know if we'll call it nice, but one of the things that came from COVID was this idea that, you can offer support groups virtually, and that's actually easier for people to attend those kinds of things. So we actually offer both. We can do in-person support groups where it's sort of warranted and makes sense, and people are interested in leaving their homes and coming to a place to have an in-person support group. But what we're finding is that most of our support groups are virtual. They have remained so since the pandemic ended. But what it has allowed us to do is sort of broaden our scope and our reach of the kinds of support groups we offer, so that we might be jurisdiction-based, but we also might be able to be more regionally based, which has really helped us reach more families. One of the other things that we're doing a lot of is educational trainings and workshops. We do these on a, excuse me, we do these on a jurisdictional level. So each FPSS might run, family peer support specialist, might run their own local training or workshop on some specific topic, but we also do a Caring for the Caregiver series of workshops and trainings that are virtual and they're offered statewide. And then we also do a community lunch and learn, which is more for providers and other organizations. And again, it's virtual and it's statewide, so we can reach a lot more folks. One of the other programs that we offer outside of our family peer support services is our family leadership development program. And really what we're trying to do here is affect change on two different levels. One is the family level, where we're helping families and parents and caregivers and others find their voice, use their stories to affect change in their own lives, in their loved one, the person that they loved with the behavioral health challenge, you know, at a small micro level or at a community, local, county, state level. We're really helping these families build connections with each other. So they're building their own natural support systems as they come together for these leadership programs. It's helping us help them promote partnerships with all the people that are supporting their loved one. So take, for example, a family with a child. We're helping them build those relationships with the school and all the various people in the school system that are supporting their child, with their other organizations, community organizations, healthcare providers. We're really helping them understand the power of their own voice and the role that they play, and sort of, you know, take the wheel, right? Be behind the wheel in those situations, and be your own best advocate, be your loved one's best advocate. But at the same time, these programs also serve a larger purpose on a systems level. It helps us identify people who have the skills and the interest in volunteering for the organization and bringing their expertise into the organization. Some of our folks that go through family leadership serve on our board. They've become family peer support specialists, or they help us in volunteer in other ways as well. They become organizational ambassadors, they become advocates in Annapolis, and we also help them find ways in the community to use their family voice in places where policies are being decided. Legislation in Annapolis, policies in some of the state agencies where there are committees and work groups and that sort of thing. We have a young adult peer program. This is, it is staffed by young adults aged 18 to 26. They offer peer-to-peer support. So they're doing meetups, because apparently when you call it support groups among that age range, you're not going to get anywhere. They have lots of Instagram Live events that they like to do. They're very present on Instagram. And so they're doing positive affirmations. They're sharing resources. They do amazing work on that platform. But the other side of our Taking Flight team is that we help them, like in our family leadership program, we help these folks find places where they will be the voice of other young adults with behavioral health challenges. So a lot of our Taking Flight staff sit on committees and work groups and commissions within various state agencies where policies and decisions about them are being made, and they have an opportunity to sit in those rooms and contribute and hopefully affect some change and be a part of the conversation, as opposed to having the conversation take place without them knowing about it. If you are so inclined and have any interest in Instagram, they are on there at mcf.taking.flight. They are also the Maryland chapter of Youth Move, if you're familiar with that. So follow them because they have lots of really great stuff. And then finally, advocacy. MCF actually has a two-part mission. Part of it is to connect, support, and empower Maryland families. The other part of it is to do what we can to influence and change and impact the behavioral health systems that all of the folks that we support are engaged in. So we have a very robust advocacy team comprised of our executive director, a committee of our board members, and a policy and advocacy associate. And they're doing things all the time, every place. I don't know how they get to all the places they get to every single day, but they just show up and they're amazing. But they're serving on statewide committees and work groups, again, representing family voice, making sure that that voice is present in the room and being taken into account as decisions are being made. We conduct focus groups. Quite often an organization or an agency will come to us and say, can you do this focus group for us? Because you have family voice and we think they'll talk to you more than they'll talk to us, and we'll get better data. We do Family Day in Annapolis, where we take about 175, 200 families down to Annapolis for the day, have them meet with their legislators and share their stories and talk about what's important to them. We educate them about some of the legislation that they might want to talk to their elected officials about. And that's their opportunity to have a voice in Annapolis. We offer oral and written testimony as well before the General Assembly for important legislation. Right now, we're knee deep in the 988 legislation and a few other pieces. And then just doing some advocacy in the media, making sure that when we're out there talking about behavioral health challenges, we are representing the voice of Maryland families so that people hear that perspective from us. You may also be aware of the Children's Mental Health Matters campaign. It's an awareness campaign that we are very proud to be a part of. You might have seen a lot of it recently because we just went through the whole campaign poster contest, and we had lots of submissions from students across the state who submitted artwork that to them represented mental health and mental well-being. And so I'm happy to say a winner has been announced. It will be unveiled. The poster will be unveiled at the CAIAS conference, I think next week. So I can't share the winner with you yet, but it's very exciting and I love the one. It was really hard. We had over 100 submissions. We managed to narrow it down to 10. I don't know how we did that. And then we had our staff vote, and then we had a voting going on over the weekend on social media. So it's been a very exciting campaign. I can't wait for everybody to see the poster. That's going to be the vision of the campaign for the next year. So that is, like I said, MCF 101. You can learn more about our work at mdcoalition.org. You can email us at help@MD Coalition. We have a family focused newsletter. If you go to our website, you can sign up for our mailing list and you'll get our newsletter. And then, of course, we're on Facebook and Instagram and LinkedIn under mdcoalition.org. I'm sorry, MD Coalition. I will also add that if you are interested, if you want to make a referral to services, just go to our website and there's a button on every single page of the website that says request services now. Short form, fill it out, and then that sort of triggers the whole process to happen. So that's it.
Thanks so much, Karen, for sharing about the Maryland Coalition of Families work. There is a lot of overlap. We look forward to continuing to co-sponsor programs together. So yeah, we really appreciate it. I had a question about the advocacy, if there was any particular bill that you wanted to call to people's attention that we can all be aware of while things are still in session.
Yeah, I know. I mean, we're starting to wind down. I think most of the hearings have taken place and testimony has been given, and now it's just to sort of wait and see. But some of the ones that we've been watching this session are the 988 bill for certain. The bill about safe consumption sites, we've been watching that very closely. There's a mental health wellness checkup, annual wellness checkup, much like you get a physical every year. There's some things about online safety measures by default and design for kids who are online using common everyday products and making the safety features sort of default instead of having to turn them on. They're just built into the system. So these are the kinds of things that we're looking at. We're always looking at things about parity with substance use, particularly in the insurance industry, and making sure that things are being covered that should be covered. And if they're not, they should be explained. It should be explained to the family why. So those are just a few of the ones that we have testified on and really been involved with this session.
Great, thanks for sharing. And I think that's a call to everyone to be, involved in local politics. Sometimes people are disillusioned with politics and how does it really affect me? But, everything that Karen just mentioned could have a direct impact on somebody's life, like as soon as it passes or doesn't. So a great call to action for all of us. Okay, so in the last 10 minutes or so that we have remaining, I'm going to turn it back over to Jade, who's going to lead us through a feedback activity. We want your opinions on various things. We've been listening over the years, and so we want to hear more from you about some of our future offerings. And some of this came directly from the mental health first aid studies that I mentioned. So yeah, Jade, take it away.
Hi, everyone. Thank you all again for participating with us. I am going to share my screen because I have created a lovely Jamboard for us to all participate today. I'm also going to release a poll in the chat for those who are not able to access the Zoom link, the Jamboard link. So we have a couple of questions that we want to go over. So if you're able to access it, you can click the sticky note, write your name, and then write your answer. If you're having any trouble with this, I have also put the poll in the chat, which has the same questions. But generally, we'd like to know if you all are interested in a monthly or bi-monthly meeting. If so, we would like to know what the time frame is, because we know everyone has different schedules. So whether or not this would be like a simple 30-minute lunch and learn bi-monthly meeting, or whether you all would be interested in after work on a Thursday at 4 o'clock. Because we really would like to have as many people able to participate as they are available. Okay, I see more people participating in the chat, so I'll go over the poll. So I'll go over some of that. So we have a lot more for bi-monthly meetings, 75%. Time frame, not so many answers on that. Content. Okay, you would like to see spotlights from different Maryland counties, especially because we are focused, our grant is focused on some specific counties. We wanted to know if there were any different groups or organizations that you would like to hear from to share some of their resources. And just any other information that you would like to see, whether it's in our newsletter or in some of these meetings. There was the option to be able to show new features, such as Zoom has this lovely new poll feature, which you can create. They also have surveys that you can add into the session. So things like that, I will go over, learn how to use these materials, and then be able to do tutorials to show for different online trainings and such.
So one of the reasons why we're asking these questions too is that some of the feedback we've gotten from our mental health first aid participants in particular, since that's our most popular program, has been that, what do we do after the training? We need contact after the training to like sort of support us and how we deliver, how we apply mental health first aid. And so we're just trying to figure out, what would be the particulars of something like that? What are you all interested in? So any feedback, a couple of these polling questions are short answers, so you can give us any suggestions and we'll take them into account as we figure out how to offer ongoing follow-up support to our trainees. And what you, yeah.
I can see the results better. I had to go into Zoom. So we had a lot of suggestions for lunchtime or early in the morning. So yeah, I expected that early in the morning before you start your workday, or a 30-minute quick Zoom meeting at lunch, like a lunch and learn. So those are good answers. Implementation procedures, resource development, that's a good one. Case discussions. This was a fantastic, would you offer a spotlight of different? Yeah, so the intent with this question was to find out if there were any particular organizations or resources that you were looking for. I would go and set up meetings with the organizations to see if they would be interested in spotlighting and sharing some of the resources and programs available to you all based on their county and different areas. As well as another option could be to discuss, have peer training sessions for our instructors, or if there are any instructors, we do have some that are trained in Overdose Lifeline series or things of that nature, to be able to discuss some of that. If there are case discussions, if you are a mental health first aider or instructor and you have different scenarios that you've interacted with in your work or activities that you would like to discuss and find out other helpful ways from different instructors and participants about how they handle the situation. Because a lot of our mental health first aid training is actually learning from each other, what works, how to deal with different cultures and stigmas and such. So that was kind of the idea with that. New tools and tricks. I'm still learning while we're going through how to make our virtual courses more interactive. One of the reasons why we included the Jamboard and the polls so that we can actually hear from our participants. So those are some of the new features that I'm looking at to be able to implement into our virtual trainings, to be able to have more participation from our registrants, as well as just finding out how we can support our partners. Okay, that sounds good. So thank you all. We definitely appreciate you being able to share this feedback in regards to what opportunities and such you would all like to see featured. If you have any other ideas or suggestions, please feel free to shoot me an email. I'm going to put my email in the chat at the moment. And we can discuss, or you can just shoot me your ideas. But ideally, we like to have more connection within this community to be able to share things, learn more tools, and also be able to highlight some of the different issues and scenarios that people may routinely encounter.
Thanks, Jade, for guiding us through that. And yes, I encourage you all to think more on it. And especially if you're a former trainee of mental health first aid yourself, or as Jade mentioned, if you're an instructor and would like, any kind of peer support there, all of our instructors, we're all in the same boat, encountering many different types of trainees for our mental health first aid classes. And so we're going to use this data that you all just shared with us, as well as any ideas that you might share after today, to put together some, I guess I'll call them, to use, language, technical assistance calls, that can be helpful for all of us, whether you're a mental health first aider trying to help somebody else, or an instructor trying to, learn new strategies for teaching classes. So thank you all for that feedback. We really value it. All right, well, that is the end of our agenda for our partners meeting today. Thank you all for sticking around and hearing about our programs and giving us feedback. We look forward to partnering with you all in the future on any of the programs that we have shared about. And thank you again to Maryland Coalition of Families for sharing about themselves during our partner spotlight. And we encourage everyone to stay in touch with ROPTA and share our info with anyone you think would be interested. So hopefully it's not too long before we see you all again. And I hope you all have a good rest of your Wednesdays.